that comes from venom, that is from snakes, some types of spiders, and certain frogs, scorpions, and some type of fishes. And in gases, the hormone monoxide and chlorine will be causing poisoning. And in foods and drinking water that has been contaminated with agricultural or industrial chemicals, spoiled food or food that has not been properly prepared or cooked, excessive alcohol consumption, and even some naturally occurring metals, arsenic, lead, or mercury. And some plants and fungi that the poison ivy, certain berries, and certain mushrooms. So how it is affecting that? It will be affecting the lymph nodes, respiratory system, skin, white blood cells, spleen, and stomach and intestines. And in lymph nodes, it will be affecting the lymphocytes and respiratory system. The airway and the mucous membrane will be affected. On the skin, it will be it will be causing a barrier against invading pathogens, and in white blood cells, it attacks the pathogens in the blood itself, and spleen assists the body in protecting itself against bacterial infection. Stomach and intestines, the stomach acid kills most harmful bacteria. And coming to the pathophysiology, the nervous system is made up of large number of nerves, and when it signals reaches the end of a nerve, it releases a substance called neurotransmitter that carries the signal to the adjacent nerves or organs such as muscle or gland. And this nerve will be releasing the substance called acetylcholine, that is a neurotransmitter. So once the signal passes to the next nerve, an enzyme called chlorine esterase that destroys the acetylcholine. Then organophosphorus compounds will block the enzyme that prevents the breakdown of acetylcholine. This acetylcholine will act as excessively long time, causing symptoms like twitches and increased secretion. So after some time the muscle gets fatigued and leading to muscle paralysis. So what are the symptoms of poisoning? So the individual can be suspected of suffering from poisoning through a set of symptoms that includes burns or redness around the lips and mouth, breathe, smells of chemicals, nausea and vomiting, trouble breathing, increased or swallowed down heart rate, diarrhea and rashes. So here you can see the drooling of foaming of the mouth. So the patient will be feeling lightheadedness and drowsiness, and the dilated or constricted pupil, and overall the patient will be in a confused state, and there may be occurrence of seizure. What are the effects of poisoning? So if you are not giving immediate first aid, the patient's condition will be worsen, and because it will be very fast affecting all the system, so the patient may develop short-term illness, brain damage, coma, and death. Treatment for poisoning. So depend on several factors that the treatment should be depend upon. We have to start based on the age and weight of the person, the knowledge, what type of substances. Sometimes some people, bystanders, they will be bringing the content to the hospital. So what the substance that the person has taken, injected or inhaled, then the allergens of the person. The first aid treatment for poisoning. So for first aid treatment, we can do these steps. So the person has swallowed the poison, try to remove anything that remains inside the person's mouth. So sometimes if they used any household cleaner, if they have the thing, we can read the label and follow the instruction and start the treatment as per the poison. And if the person has any absorbed by skin, so by contaminated clothing, so make sure you're wearing the gloves for at least 15 to 20 minutes. We should rinse the skin through the running water like a shower or a hose. And if sometimes if the poison has contaminated ice, gently flush it out with a cool or lukewarm water. So we have to do it for 20 minutes until the help comes. And in case of vomiting, make sure to turn the person to their side, so prevents them from choking. And if the person is unresponsive, unconscious, and not breathing begins CPR. So what are the preventive measures of poisoning? So at a home or workplace, poisoning can be largely prevented by taking a lot of extra measures, especially when it comes to storage of chemicals and other substances that may cause poisoning. And make sure to store all household substances, chemicals and medications in a secure location that is out of reach of children. And ideal storage location is a high cabinet, and even we can establish no children zones inside the house, and they don't go playing around the areas. So make sure you're supervising the students when they go out, and your children should be in your control. And make it a point to use gloves and other protective clothing if you're going to work with the cleaners and other toxic chemicals. And avoid use of chemicals like paint thinners, pesticides and other chemicals inside the house or in any closed space. Ideally, these chemicals should be used in a location where there is proper ventilation. And refrain from mixing chemicals because that could lead to a deadly combination. Good examples are bleach and ammonia because which form a lethal gas. And as much as possible, keep medicines and other chemicals in these original packaging and containers, and make sure everything inside the medicine cabinet is properly labeled. And throw away expired medicines and other household products. Ensure that you are properly following FDA guidelines. Always make sure you are following the instructions in the label. Thank you.